positive for the coronavirus disease, while 26,494 have died from the outbreak. Yesterday alone, within a period of 24 hours, Italy reported 971 deaths, while Spain recorded 769. The United States recorded a total of 16,894 new cases, with 252 deaths in a period of 24 hours. This scenario reflects the possible outcomes that we are likely to face if we are complacent with the measures that the government has put in place. In our situation, in the last 24 hours, a total of 69 samples from suspected cases of coronavirus have been analyzed in our various laboratories. Out of those, we have received confirmation that 4 people have tested positive for the disease. They include 1 Kenyan and 3 foreigners from America, Cameroon, and Burkina Faso. This now brings to 42 the number of those who have tested positive for the virus in Kenya. Of the 4 confirmed cases, 3 are based in Nairobi and 1 from Mombasa. Consequently, Nairobi continues to lead with 31 cases, followed by Kilifi with 6, Mombasa with 3, while Kajiado and Kwale have 1 each. 24 out of the 42, 24 are male, while 18 are female. Tracing of contacts continues and is ongoing. The total number of close contacts that we are monitoring as we speak are 1,426. Out of this number, 215 have been discharged after completing the mandatory 14-day follow-up period. Currently, our teams are monitoring nearly 1,000 people who have been in close contact. We have 18 individuals admitted at Bagathi Hospital waiting test results. Today, our medical teams have embarked on a mass testing for all those persons who arrived in the country last week and are currently under mandatory quarantine in various designated hotels and government facilities. These tests are based on the arrival dates. However, those who will test positive will be taken to isolation facilities. The exercise will continue until those in the facilities are all tested. We want to appeal to all Kenyans to embrace the fight against coronavirus, as opposed to assuming that this is a government affair, because it is not. And to that effect, it is really, really wrong and disheartening for those particularly in leadership to continue perpetuating false information that have got nothing to do with the real cases, trying to gain political mileage out of a disease is as immoral as anyone could ever imagine. It is the worst of what we can see in terms of political maneuver, and it is wrong. It symbolizes everything that is wrong with our society. For instance, we have noted that misinformation is doing the rounds in social media, where a leader in the country is claiming that there are over 7,000 people in mandatory quarantine. And while this may ultimately be the case, and even perhaps even more people might get into quarantine, it is simply at the moment not true. So why would you wish, as a leader of society, it sounds like a wish, why would you wish that 7,000 Kenyans should be in quarantine? And why would you think that the government is not telling you the truth? To hide it for what purpose? So it's really disheartening. And for the record, we have 2,050 people currently in mandatory quarantine in 14 designated places, in hotels and government designated places. So it's unethical really for anyone, and more so one purporting to be a leader, to mislead people for whatever reasons they may particularly have in regards to the fight against coronavirus. Fellow Kenyans, we want to inform you that we are expanding our capacity for the purposes of intervention measures, particularly in the counties. I want to take this opportunity to say that as NAC, we are particularly grateful to the initiatives of the private sector and other donor communities who are working with the government are achieving. Private sector, for instance, has identified various areas, including schools, including air freight hangars, that can be used if the need were to arise. They can be used as hospitals, isolation facilities, if we were to go that far. And let me make it clear that there is no country on earth that has managed to contain this disease on just existing health facilities. So we know that going forward, it is indeed very likely that our health facilities can and could be overrun by just the demands. And this is why we are saying this is not a government issue alone. The protection of each individual's life, the protection against this disease is an individual responsibility as it is a community responsibility. And what we are asking our community, the business community, the religious community, everybody, is let us think ahead together. Let us ask ourselves realistically, if in other countries, if the British NHS, National Health Service in the UK, has already been overrun by the demands of the illness, even Italy it has happened, and even America is claiming that they don't have this and they don't have the other, and their health facilities have also been overrun. Isn't it realistic to imagine that it could also happen here? And criticizing the government at that point is just adding insult to injury to Kenyans. It is at that point that we as a nation should do what we have always done in times of extreme testing and in times of extreme challenges. We have always come together in our communities, in our villages, and done what needs to be done. In this particular case, we need to be looking as communities in your villages, what are the secondary schools, particularly boarding secondary schools, that we can begin to identify as potential areas where we can keep the sick if the situation overruns. We ought to be identifying what sort of Nyumba Kumi initiatives should we have. If that happens, there will be no need to cry wolf and to start blaming the government at that point, because it will be late. We need to think about owning this process as a government, as a community, and as Kenyans. Let us appreciate this is a Kenyans issue, And every Kenyan should be on board to try and resolve the problem long before it becomes a menace to the rest of us and to all of us. So when I do this, I do not do so to minimize or diminish our responsibility as a government. I do so as a clarion call for us as Kenyans to be ready for any eventuality. We have always done that in times challenged, such as this that we expect. At the same time, I want to urge employers, as I did yesterday, to kindly release their employees in time to be able to meet the curfew time of 7 p.m. If they do not want to allow their employees to leave on time, then they should prepare accommodation for them. What they cannot do is to release somebody half an hour before 7 o'clock, or at a time that they are so sure that they cannot get home by 7 o'clock. So if you cannot release your employees on time, please prepare accommodation for them. It is unfair to release somebody half an hour, 6:30, and they live in they live in Thika, and you tell them they should leave at 6:30. It is unfair, and it should not happen. And this is where we ask for responsibility, even amongst our business community. And so, ladies and gentlemen, as I come to the end, I would like to once again emphasize the need for us to observe hygienic behavior. We are asking each and every person, and as I said yesterday, if you look at the person next to you, given the fact that we have 42 people now who are spread in the counties that we have established, when you look at the person next to you, they will not have any sign that they are unwell. They will not have any sign, that they are positive. But they could well be positive. Keeping your distance, physical distance, is what is going to ensure that you do not also become positive. That's a responsibility you owe to yourself. Thank you very much indeed. Okay, thank you very much. Let me say this. First and foremost, we are purchasing, we are buying, and we are already accumulating ventilators in our hospitals. We are importing ventilators from many parts of the world. As you are well aware yourself, there is a shortage of ventilators across. However, we have got people who are also assisting us. I would like to mention here that the World Bank, for example, has donated 250 ventilators. That is in addition to everything else that we are buying. And what I can tell you is that every effort is being made to secure as many of them as possible. As I have just mentioned, we must also begin to build internal capacity for materials. For example, when it comes to personal protective gear, we are now at a place where we believe that starting next week, we can actually be able to start manufacturing those materials ourselves. And I want to thank, as I did, and I know that CS Betty is here with us. I think she is behind me. You mentioned something. that we are doing everything we can, not only to create capability for ourselves, but possibly even to assist the region. So we are working on ensuring that we have those. We have ICU beds. We have got capacity for at least 1,000 beds that we are putting in addition to whatever else have existed in the past in terms of ICU capacity. So we continue to build every day we continue to build extra capacity. And I can tell you, we are a long way from where we were a while back. On the issue of, so let me just stop there to say this. If indeed it comes to the fact that we run short of the materials that we are accumulating, it will not be because we did not do everything that we can to ensure that we do have those materials. And I can tell you, and I want to thank our industries and our scientists because of what they continue. They continue to not to surprise us, but to make us happy with what they are nothing. We want to use capacity we have in the country, in our tailoring sector, for example, to start producing masks in the country. So within a very short time, we will not need to import masks. We will make them here. We are looking at possibilities of making personal protective gear here. And I would like to ask Betty to say something on this. Oh yes. Okay. Let me say this. Every institution in the country, every medical institution in the country, may it be Kenyatta National Hospital, may it be other hospitals, level 4 and level 5 hospitals, we are looking at in the next 1 week hiring at least 1,000 more employees. And as the need arises, we will increase those ones. The beauty is that we are not short at the moment. We are not short of medical personnel. It is just they are not in our hospitals, but we have them out there, looking for jobs and wanting to join. So we have that opportunity that is going around. Obviously, it's a process going on because you cannot bring in 2,000 people into your hospital. There has to be some sort of arrangement. They come in, they get acclimatized. As they do so, you get another lot. So we will hire as the necessity arises.
Thank you very much. Thank you very much, CS Kagwe. I'd like to confirm that within Kenya there are more than 50 companies that are capable of providing some of these medical inputs. We started obviously with things like sanitizers, and we've seen a large number come into the market. Our textile sector has confirmed that they have capacity to be able to make the PPEs. And we're in conversations also with our motor sector to see if they can also make some of these ventilators. They've not had to do it in the past, but they have that capacity. So we are confident, working also with our scientists and our engineers, that we can build greater capacity to be able to supply these goods within the country. Thank you very much.
Sheria haina wakubwa. Sheria haijui mkubwa ama mdogo. Ukiwa umevunja sheria, utashtakiwa. Lazima ushtakiwe. Sio mimi nasema. Sio mimi naamini ati yeye atashikwa. Ni vile sheria iko. Huwezi kuambia Wakenya uongo. Huwezi kusema uongo. Sana sana kulingana na vile tunaona, wewe uanze kuambia watu ati iko wagonjwa wengi kuliko wale tuko nao. Alafu unafikiria hiyo maneno itaenda tu hivyo hivyo. Sasa tukiruhusu watu wafanye hivyo, jameni, Si wengine wataanza kusema watu 40 ama 60 wamekufa. Kwa hivyo ukiruhusu mtu mmoja, uruhusu wote. Ukishika mmoja, ushike wote. Let me put it this way. Nobody is going home on the call of a favor. Let me first of all stop that. No, because I have got, as I said yesterday, if I'm going to give a favor, why would I leave my sister's child in quarantine? You know, that's the first one I would start with. So I've got friends of mine who have got their children in there, in quarantine. And the point I have made is this. It is a good thing when your child is in quarantine or your friend is in quarantine. It's a good thing because you don't know whether they have it or not. And for us parents, when your child is in quarantine and you bring them to your house, what you are doing is exposing yourself, because given the statistics, they may very well live, but you may very well die. There are cases, for example, there has been cases of people who came from the UK and they came on medical grounds. They were sick. They had gone for treatment. So, and the doctors, and we have said if a doctor can come and show that this is my patient, I am prepared to go and treat them and quarantine them in their own place or their own homes, we have no issue with that. Because also, the last thing that we want is to detain a sick patient where they are not reachable by their doctors. So on a doctor's setting, we have said yes, there is a doctor setting. The doctor has said that this is my patient, and we have, I think, on 2-3, no more than that, and I think that Dr. Amos can confirm that. But we are not releasing anybody on the basis of friendship. But can I just add one more thing? And that is the reason why we would never do that. We have an opportunity to break the cycle and not to reach the point that I was describing earlier. You know, a situation where we have got mass sickness. We have an opportunity. And this is what I want to emphasize on. Let us take advantage of this opportunity. Let's break this cycle. If we do what we are saying, and if we follow the rules that we are saying, that opportunity is still with Kenyans. Please, let's do it. Let's just show the rest of the world and to show ourselves that indeed we can do it. The last one here? Oh, okay, sorry. There is not a single person who has been reported infected in Kenya or otherwise that whose contacts we are not following. We are not just following the contacts. In some cases, we are even following the contacts of the contacts. You know, so we are not leaving any stone unturned in this fight. And I can say, and I thank Safaricom because they are also assisting us with ensuring that even where people are, we can still be able, even after release, we can still be able to talk to them and to follow them and to know what locations they are, because that is very important for us to protect them. Finally, Hiyo kemikali inaitwa sanitizer. Lakini hebu nimweleze kitu kimoja. Sanitizer ni ya kutumia ukiwa huna maji na huwezi kufikia maji na sabuni. Ile kitu inasaidia sana kupigana na hii ugonjwa ni usafi. Ni usafi. Wewe uwe msafi. Na unajikinga na njia fupi sana. Na njia rahisi sana. Chukua sabuni, osha mkono na njia inaofaa, nawa mkono na njia inaofaa, na utakuwa sawa. Ukiwa tu unafanya hivyo, vile vile wale ambao mko nyumba na hao wanafanya vile vile, na sana sana kukaa mbali kidogo na marafiki, kwa sababu huwezi kujua kama rafiki yako ana hii ugonjwa ama hana. Huwezi kuona na macho huwezi kujua. Kuna wale wanafikiria ati ukiwa na coronavirus, ukiwa hapo tunakuona na tunajua wewe una coronavirus. Sio hivyo. Sio wewe. Nasema kwa ufupi njia ya kujikinga ni ukae kidogo, mitali 2 unakaa mbali kidogo. Lakini vile vile wale ambao wako sokoni, wananchi wale wanaenda kununua mboga ama chochote, tafadhalini wewe goja mwenzako anunue kile ananunua, alafu wewe ukaribie pahali ulikuwa unakaribia, pahali unataka kununua kile unataka kununua. Lakini ile mambo inaharibu ni kusukumana, watu wanashikana, wengine hawajaelewa ati hii maneno tunayo sio maneno rahisi, na ni lazima kila mtu anajichunga yeye mwenyewe. Usigoje serikali ikushunge, jishunge wewe mwenyewe, kwa sababu wewe na yule mwingine ndio serikali na ndio Kenya. Kwa hivyo hii maneno si ya serikali pekee. Hii ni maneno ambao lazima tushikane pamoja, lazima tuungane pamoja, lazima watu wakiwa nyumbani, watu wakiwa nyumba 10, watu wakiwa katika familia, ni lazima zote tunafanya kazi pamoja, na ni lazima zote tunasaidiana pamoja. Vile vile ningetaka kusihi wale ambao wako viongozi, tafadhalini msije mkalete mzaha na mambo ambayo ni mangumu na ni mambo ambayo inaleta shida katika nchi yetu ya Kenya. Kwa hivyo ukiwa mwanasiasa kama mimi ni mwanasiasa, tafadhalini sisi wanasiasa kwa wakati huu washeni tuweke usiasa upande, tuwashie madaktari wasungumze habari ya hii ugonjwa, hii virusi, kwa sababu wewe sio daktari. Kama daktari hazungumuzi siasa, na wewe usizungumze mambo ya wadaktari, tafadhalini. As far as doctors are concerned, vile vile tunataka kuchunga sana maisha ya madaktari na wale ambao wanafanya kazi katika hii sekta ya health, kwa sababu hao ndio askari wetu wa mstari wa mbele, na wakiwa wagonjwa basi sisi tunafanya nini? Tutachungwa na nani? Kwa hivyo we are ensuring at every point, and that's why when the CS for Trade was talking here, she emphasized our capacity now to be able to make our PPEs, because once we can make our own PPEs, then you can be sure that we will cover 100% of our health workers. And so far we've been lucky. We have heard how in other countries a lot of their nurses and doctors have tested positive. We are lucky in that sense. It has not happened in Kenya yet, and we hope it stays that way. And the way to make it stay that way is to make sure that we have got sufficient protective gear, and we will do everything within our powers. And we continue to thank them, those working in laboratories, those working in the wards, those doctors who are on call perpetually, everybody who is in every other sector in the health industry. And I want to thank the security operators, because the reports we are getting is that yesterday they were very helpful to those in the health sector who are traveling at night and going elsewhere for their duties. Let's continue that way. But fellow Kenyans, let us work together to see whether we can break this cycle and save Kenyans. Thank you very much. Kwa sababu kafyu iko karibu kwanza, ningetaka ndugu yangu Governor Kuti aseme moja mbili ambayo inahusu mambo ya counties.
Asante sana. Nitasema kwa Kiswahili na kwa kifupi sana ya kwamba nashukuru vile governors wamechukua uongozi na kuhakikisha ya kwamba counties zinajitayarisha kwa haya mambo ambaye ingawa tunaomba Mungu yasitufikie, pia tunajitayarisha iwapo ikifika tuwe tayari. Nashukuru ya kwamba tumetengeneza county emergency response teams ikiwa pamoja na county commissioners, national government ikichanganyika na county national government na county government wakiwa wanafanya kazi pamoja. Leo mumesikia umuhimu ya kufanya kazi pamoja, serikali, wananchi, viongozi wa dini, viongozi wa siasa, ili tuweze sisi wote katika kila county tushiriki, tukae pamoja na tuone ni namna gani tutashinda hii ugonjwa. Kama wewe uko na ujuzi ya kutengeneza masks katika county, ni muhimu county emergency response team ipatie local capacity ili tuweze kutengeneza facial masks, protective gear, kwa sababu hii leo ni mafunzo kwetu. Sio tu tunaongojea namna ya kuepuka hii ugonjwa, baada ya hii ugonjwa, kwa sababu katika kila shida lazima kuwe na opportunity. Kwa hivyo opportunity ya kuamsha uwezo wetu wa kujitegemea, hii ugonjwa imetufunza, kwa sababu kama ni ventilators, umeona kila dunia inakimbiza, haitoshi, hata even developed world hawana. Kwa hivyo ni muhimu tusaidiane. Kama ni mambo ya mashule, lazima kwa wakati huu kila county itambue ni shule gani zitakuwa quarantine, kwa sababu isolation haitatosha, na mahospitali yakifurika lazima tupange tutaenda wapi. Kwa hivyo hayo ndio message ya leo, na mimi nashukuru sana kazi ambayo inafanyika katika counties kusafisha masoko, kueneza watu warudi nyumbani mapema, kusafisha mikono, na ninashukuru pia sasa hata watu wa dini ambao juzi walikuwa wameendelea na kukusanya watu kwa maombi. Mara hii ninashukuru sana, na kwa hivyo hii ni wakati wa Kenya kuja pamoja, ni wakati wa kuweka siasa kando, ni wakati ya kuhakikisha kila county imejipanga ili ikija wakati huo tuko tayari. Asante sana.